With the flu season just around the corner and coinciding with the pandemic, parents are concerned about their kids' health. Now, in today's Keiki Talk segment, we're learning all about fevers and when you should be going to the doctor's office for one with pediatrician Dr. Teresa Wee. Good morning, Dr. Wee.
Good morning, Kelly.
All right, so first off, and I think most people have a general idea, but what exactly is a fever?
Well, I've been getting so many calls about fever. So fever, the normal temperature range is between 97.6 and 99.6. So really a fever would be anything above 100, 100.4, 100.5. So it's really important that we all practice how to take accurate temperatures, because when you call the doctor, you want to make sure that temperature is accurate.
And speaking of the doctor, when is it, I guess, necessary to go in? Because I know a lot of times people, when you have a fever, we have our own home remedies, and all of our moms and grandmas might do different things. But when is it necessary to actually go in to really get it treated?
So I'm talking about Keikis right now. Now, of course, children who are under 2 months of age, really, you need to be a lot more careful with fever or any other symptom. But let's talk about the general Keiki population. I think when you feel that the temperature has gone on for a couple of days, in other words, we need to understand that fever is a natural response of your body's immune system to fight bacteria, viral invaders. So when you first note a fever and the child's happy and running around, you may not want to call your physician in a panic right at that time. You may want to, watch and see if other symptoms arise. And so I want to take away the myth that with older kids, fever, it's not your obligation as parents to squash it immediately, because studies are showing now that fevers actually elicit chemicals in our bodies that help our body to fight the immune system.
Oh, interesting.
Yeah.
And when it comes to, especially now that, this is coinciding with a pandemic, when it comes to coronavirus, the fever would be just the same as a flu fever. So how would you know the difference? I'm sure a lot of people, parents especially during this time, if their kid does get really sick, they're going to think the worst. So what would you recommend, I guess, in terms of differentiating between coronavirus and the flu, and should they be treated any differently?
Basically, we won't know if it's the flu, if it's coronavirus, or just the run-of-the-mill virus. And in all cases, we really, well, especially in the flu, we do have possibly, Tamiflu that might help initially, but we don't really have effective treatments for the flu. So we would just, again, look at the total picture. People call me after hours, and I tell people, it's not just the temperature that you would run to the emergency room. We have to look at how is the child eating, sleeping, is the child vomiting, complaining of pain in the ear, sore throat. So I tell parents to get a comprehensive look of the entire picture. And if the child is comfortable and you can do supportive measures, you could probably wait a day or two and then give your doctor a call.
Right.
So again, is it coronavirus? I would have to ask you, has there been a family member exposed to coronavirus? Has there been recent travel and all of those sort of things? But children in general do not get severe symptoms or can be asymptomatic with coronavirus.
Right. And speaking of, those other symptoms to be looking out for, can you tell us what are febrile seizures? Am I saying that right?
It's febrile seizures.
Febrile seizures. What exactly is that?
So again, in children 5 or 6 years and under, because their neurological system is still developing, if you have a sudden rise or drop in temperature, they can develop a seizure. And that's what kids are parents are very concerned about. But studies have shown that it only occurs in about 2 to 5% of children, with a 30 to 40% chance of recurrence. It causes no brain damage at all. And febrile seizures are just one of those things that happens. And again, that doesn't mean that we have to squash every single fever that occurs immediately.
Okay, good to know. I hadn't heard of those, but I can imagine at home if that were to happen, that is terrifying. So good to know and have that knowledge
Yes.
under your belt. Well, again, we during this time should be preparing for flu season, especially as it's coinciding with the coronavirus. Of course, a lot of folks and doctors doing the telehealth meetings
Yes.
and appointments. So that's something that I'm sure a lot of folks are going to be utilizing in the coming weeks and coming months. Thank you so much, Dr. Wee, for joining us this morning and breaking that down for us.
Thank you. Make sure you get your child's vaccine and well child too.
Yes, now is the time for those flu shots.